70% of the world's poor live in rural areas, and many governments recognise that delivering sustainable water, sanitation and hygiene is essential in meeting long-term development goals and in improving the lives of millions.
The government of the United Republic of Tanzania has identified access to sustainable, clean and safe water supply and sanitation services as one of the pillars of the poverty reduction strategy.
Access to water and sanitation, along with improved hygiene behaviour, can improve health, increase the effectiveness of education, and improve economic performance. In addition, the desire for clean water consistently emerges in participatory poverty assessments within the top 3 needs of the rural poor. Since World Bank investments in rural water and sanitation began in the 1970s, many lessons have emerged. First, governments and their partners have learned that decentralising management to the lowest appropriate level, coupled with close community involvement in planning and implementation, provides a solid foundation for sustainable services. Second, linking rural water and sanitation investments with the broader development context allows institutions to respond to and support a range of community needs in a cost-effective manner. Third, integrating sanitation and hygiene in rural water projects ensures that health benefits from increasing water supply are realised. Finally, addressing post-construction sustainability ensures that institutions, funds and expertise are available to keep rural water supply systems sustainable. While the bank, its clients and partners continue to innovate, the focus is now shifting to how to take these experiences and scale them up. How does the bank respond to its clients who are eager to take up the large challenge of expanding sustainable coverage, meeting the Millennium Development Goals, and going beyond?
One important aspect that we have seen over the years is that there have been too many pilot projects. There have been too many experiences with where they stop at the pilot level. I think it's time to move up. I think it's time to scale up, and a massive way of doing it. One way of doing it is through budgetary support, to do it in an ordinary way by mobilizing the donors, the government people, the consumer, all stakeholders, so that you go in a massive scaling up to show result quickly on the ground and in a very sustainable way.
By providing support directly to national budgets, we can help our clients who want to move beyond pilots and isolated projects and focus on expanding sustainable coverage. At the same time, we can help them improve their own governance and financial systems.
A country needs support in a recurrent and predictable way and is consistent with the medium-term policy framework. And budget support instruments help us to do this in a way that is consistent with the poverty reduction support programs that are in the country.
Budget support instruments designed to assist the implementation of a national poverty reduction strategy paper in an IDA country are called Poverty Reduction Support Credits, or PRSCs.
What we have come to use PRSCs for is that they support actually a whole range of policies that are defined in the PRSP. So they are usually multisectoral. They include human development aspects. Many of them now include rural water aspects, such as the PRSCs for Benin and Uganda.
By providing resources directly to national budgets, PRSCs are able to address country poverty reduction strategies and support governments who wish to move away from implementing discrete projects.
What PRSC does is that it gives an opportunity for scaling up. It also looks at systems development across the board, financial management, procurement management, systems across pay reforms. These are all issues that impact rural water supply, but that cannot be dealt with in an operation, an investment operation.
Although few in number, PRSCs containing rural water supply and sanitation are a growing business line of the bank. The first PRSC came about in Uganda to address health and education. rural water supply soon followed.
As a result of the Uganda Poverty Assessment Study, they found out that 1 in 4 people were without water, and water was very important to the lives of the rural people in particular. So the team was called in to see whether we could integrate rural water supply into PRC operation.
Adhering to key building blocks of annual budget support can help ensure success. First and foremost is good preparation and having a sector plan.
We need to have a national strategy which clearly articulates how the poverty reduction can be achieved through various sector programs. It also needs to have a clear analysis of what are the priorities in the sector that are going to be supported by the PRSC.
It took about a year of analytical work trying to establish the fundamentals. We spent the time to get the analytical framework right, and following from there it was very easy then to integrate with health and education and roll it into an annual cycle of investments that could be financed through a budget support instrument like the PRSC.
Operationalising the sector plan can be effective if donor support in a country is aligned. Harmonising independent projects and programs is not simple, but can reap significant gains in terms of easing government reform efforts and delivering investments at scale.
In Uganda, the water sector used to have 25 project management units, and each donor going their separate ways, doing their flagship projects all over the place. And that, even though it seemed to be useful in those days, it was becoming counterproductive, and the transaction costs for management of these projects was becoming very expensive. So once we built a sector investment program, the other area was to bring the donors and the government institutions that were responsible for water, both local governments and central governments, and virtually all the bilaterals and multilaterals around the table. It's provided one common platform for all donors to engage using national systems, and that has, as it were, helped the government to build on its systems.
Including rural water supply and sanitation in the Medium-Term Expenditure Framework, or MTEF, is the key step to linking the sector with national development strategies. The MTEF is the result of a top-down government resource envelope and a bottom-up estimate carrying out policies at local levels.
Now, the value added that the MTEF provides really comes from integrating these two parts, the budget ceiling and constraints with the bottom-up cost estimates. While the top-down resource envelope is determined by fiscal and macroeconomic projections, the bottom-up estimation of costs is really the work of the individual sectors.
You know what the whole envelope is all like, and you analyze it, and you know also how much each district is going to get through the formula-based allocation. To poorer districts get more money as against communities that have improved water supply. Once you have all that, it was then easy for us to agree in terms of the budget cycle, as it were in Uganda. It starts in October and ends in May. And the time between November and May is the consultation process. First of all, bringing the MTEF, the 3-year cycle, into an annual cycle, and then also trying to get a feedback from the district, the local governments, and aggregating these district programs into a national program.